So we now are moving through to our second speaker. So I would like to provide a very warm welcome to Terry Stathakis from KOTA. And Terry's going to talk to us today about the new Aged Care Navigator trial. So welcome, Terry.
Thank you. Thank you, Wendy. Hello to everybody. So yes, good afternoon. As Wendy mentioned, my name is Terry Stathakis. It's a pleasure to be with you here today. Thank you to Carers New South Wales for inviting me. I'm here to talk to you about exploring the new Aged Care Navigator trial with KODA New South Wales. And just a little bit about me. I am the team leader of the Aged Care Navigator trial project with KODA New South Wales. I'll be talking about the project, and at the end of my presentation, I'll be happy to take questions and answer your questions. If I'm unable to answer them on the spot, by all means, I would love to get your contact details, or I'll give you my contact details and you can contact me with that question. So I'll begin with a little bit of background on KODA New South Wales on the next slide. So KODA New South Wales is a peak organisation in New South Wales for people over the age of 50. Our vision is that ageing in Australia is a time of opportunity and influence. And our mission is to advance the rights, interests and futures of Australians as we age. Now, KODA New South Wales is one of several KODAs across the country, and it is state-based organisations with our parent company being KOTA Australia. Now, if you haven't heard of us before, KOTA stands for Council on the Ageing. So with the friendly acronym of KOTA. And next slide, please. Oh, just the one before. We'll go back one. There we go. So KODA New South Wales advocates for changes to policy and services at a New South Wales level. So we work with politicians, policymakers, service providers and the media to ensure that the views of older people are heard and acted on. With KODA New South Wales, there is a range of projects and programs going on, not just the Aged Care Navigator, which I'm a part of. There's community speakers programs, legal pathways program, Living Longer, Living Stronger exercise program that we run with partners across the state. And so there's a whole range of initiatives going on. And next slide, please. So the Aged Care Navigator trial. So put simply, what is it? So the Aged Care Navigator service offers free, independent support to people who need assistance to understand, connect or select aged care services. And I know how complex the system can be. My background is as an aged care assessor, so ACAT assessor. So I have back in Victoria. So I have first-hand experience at how complicated and difficult it can be for the person being assessed, their families and their carers to access services, where to go, what to do. So navigators such as myself, we provide one-on-one support to people who need assistance to understand aged care. So all facets of the system. Next slide, please. So the main objective, simply put, the Aged Care Navigator trials are testing ways to improve access to aged care services. Just as simple as that. We know it's complicated, we know it's a maze, and you know, to even people who often are within the sector themselves, sometimes it just cannot be easy. So this was a gap that was identified, and we're working to sort of bridge that gap, and you know, we'll hopefully get to a point where this will be permanent and not just, and we'll get some good results out of this trial. So our next slide, please. So who runs the trials? So it's led by our parent organisation, KODA Australia, and it's funded by the Australian government. We are one of 22 partner organisations involved in this project, and they're running it around the nation. So all the other state-based KODAs as well as other organisations are participating. The project will be evaluated by an independent party, AHA, the Australian Healthcare Associates. Next slide. And it's not a new initiative. It has been running for a few years now. The original trial ran from 2018 to earlier this year. The trial has been extended to the end of next year, the end of 2022. It's been extended. It's been designed to ensure that continuity of face-to-face Navigator services continue while a national network of local care finders is established. So what they mean by local care finders is having a local support service wherever you are that's able to assist you face-to-face or over the phone to help you navigate through the time that you're trying to access a service or get into the aged care system. And that's looking to be implemented at the beginning of 2023. Next slide. So the aim of aged care navigators is to assist people in identifying, accessing and using the aged care service system. So that's achieved by the provision of information and support for the person seeking assistance. And next slide. So what are some of the things that we assist people with? One of the most prevalent simple requests we get is people to want assistance with registering for My Aged Care. They know that they want some assistance with the service, but they don't know where to begin. Many people haven't heard of My Aged Care. It's been in existence now for about 5 years, and it is the central gateway, the one-stop shop for entry into the aged care system, whether it be for home supports, home care packages, residential respite, residential care. So we can assist with that process, as it can be quite daunting for many people to do unassisted. We can assist the person to understand what supports are out there, what supports they can receive, with getting making that first step towards making contact with My Aged Care. Also, once the assessment occurs with the aged care assessors or the home support assessors, we can also assist the person or their families or their carers find a service provider or residential care facility. We don't necessarily make recommendations. We can't do that. We're impartial. However, we can assist you with sifting through the very many providers that are out there and helping you, as the title is called, navigating the system. We can also assist you with understanding and filling out some of these complicated forms. And when it comes time to being assessed, many people don't have that support person with them, or the support person might be unavailable. And if that's the case, we're happy to attend that assessment meeting with you face-to-face in a perfect non-lockdown world, of course, and even attend the assessment meeting with the older person and their carer also. Next slide. So our model for support is based on face-to-face, online or phone support. We would love to offer a face-to-face service at the moment, but obviously we know that that's not possible right now. We're looking at getting physical office space at probably the beginning of next year. Let's be realistic. So at the moment we are doing all of our work over the phone, via email, Zoom, Skype, online. And part of our model is to offer that individual and group support. And we have a group of wonderful volunteer community speakers who assist us with providing those group information sessions. And I'll talk more about those volunteer community speakers a little later on. We do have a very flexible service to meet the needs of the person. And when I say flexible service, it's either we can come to the person's home, they can come to us, we can meet in a neutral place where the person feels most comfortable. We can do it over the phone, via email or online. And it goes without saying that we do follow that person-centered approach. Next slide. Now we have a target area, a specific target area, but that's not to say that we're not going to assist anyone else that's not in these areas. But the specific focus for KODA New South Wales for this round of the trial is mostly the outer western suburbs of Sydney along the M4 corridor. And when I say that area, it's generally from the Blacktown Council area through to Penrith, Blue Mountains, and the Hawkesbury, Lower Hawkesbury region. Next slide. So the rationale for making it sort of specified to one particular region was that with the previous trial, we had found that there were a number of people in need in those particular geographical regions. And we had established networks in those areas, particularly with other organisations, other community centres and organisations, local councils. So we had those established networks and referral pathways. And we are also focusing, part of our re-entry into this trial is to assist people who are isolated and vulnerable, and with a specific focus on the following target populations: people with lower, limited access to technology, lower health literacy, financially and socially disadvantaged people, people who live in more remote areas, such as, in some Blue Mountains regions where there's not as many services directly available or immediately available, people with cognitive impairments and so forth. So that's specifically what we've targeted. But if we move on to the next slide, I'll further explain what happens if you're not in that particular target area. At the moment, as I said, we're not doing face-to-face because we can't, we're not allowed. So I'm actually taking referrals from anybody over the phone, email. So if you live in northern Sydney, I've even had a few people from country towns that have called me. I'm more than happy to assist. And once our trial gets back up and running in a normal world, we do have out of target area assistance. So if you are in not one of those areas I've specified, you can either call the phone number I've got on screen, 1300 268 228, and they can assist you with finding a navigator in your area, or simply a postcode finder on the KODA Australia website that I've listed there. And if you cannot find a provider or a navigator in your area after doing all of that, please come to us. We're not going to leave anyone unassisted, so that's not what we're about. So please don't feel like you're being left out in the cold. So the next slide. So where do our referrals come from? Mostly they're self-referrals from the older person themselves, their carers, their families, wanting to know more about how to get into the aged care system, our fellow networks, local councils, other community organisations and service providers, health service networks, hospitals, doctors, nurses, GPs, social workers and such. So that's where our referrals come from. Next slide. And I mentioned the volunteer community speakers earlier. So it's a wonderful group of dedicated volunteers who provide our group information sessions to older people and their families and carers. And these are delivered usually as part of a referral from a community organisation that has a group of people that are interested in receiving some basic information. The aim is to provide those basic, simple, easy to understand information. And it's more of an outreach service as well. We can provide that assistance anywhere, not just in one particular area. Next slide. So as far as the aged care navigators like myself go, with face-to-face service, it's not volunteer-based. You do get a trained aged care navigator. And we offer that individual support to access the aged care system, whether it be a walk-in in our yet-to-be-determined office space, watch this space, or the appointment in our office, an appointment in the person's home, or wherever they feel comfortable, over the phone or online. Next slide. And I wanted to briefly touch on the Federation of Ethnic Communities Council of Australia, Becca, a well-respected organisation, who have started the Encompass trial, which is a referral pathway for people from culturally and linguistically diverse backgrounds who require navigator services. and we may not be able to assist if we don't have the resources. So what you can do is you can visit the website that I've got on the screen there, fecca.org.au Encompass, or call their phone number 6282 5755, and they'll put you through to a multicultural aged care connector in your area. And next slide. And this is my final slide before I go into questions. This is our contact information. I've got our website address up there at kodanewsouthwales.com.au if you'd like to learn more about what we do. The email, which is the Aged Care System Navigator email right there, acsn@kodanewsouthwales.com.au. We have our office phone number, which at the moment is not attended. It will take you through to the mobile number. So by all means call that, but you're probably best calling that mobile at the moment if you really need some assistance. And it's 0438 431 817. If that's not attended, there is a second one too. So it's 0483 179 537. And to be advised, for our brand spanking new office space, which will be based in the western suburbs at a yet to be determined location, we're very close to getting one. So I'm happy to take some questions if there are any.
So Luke, I definitely have some, Terry, I definitely have some questions for you.
Yes.
And I encourage the people listening in to post any questions you might have in the chat, in the Q&A section. So first of all, what sort of support and inclusion is offered to carers with this system navigation?
So it can be very difficult to navigate the system, not just for the older person, but for the carers as well. So we welcome carers to contact us and we can help them directly. Most of the people I deal with over the phone are carers, and they're either at their wits' end, not knowing what to do, frustrated with current providers, frustrated with not being able to, basically being shuffled around a lot and not knowing where to go next, not knowing where to go if they want to make a complaint. So they can come to us and we can assist them as best we can. And if we're not the organisation to do that, then we can, warmly refer them elsewhere.
Fantastic. So you're able to help them move through to the right person that might be able to support that particular concern.
Yeah, but definitely not most, but a large number of our referrals come from carers also.
Okay, fantastic. And what sort of training and experience do the navigators have? Is it sort of consistent across New South Wales, or is it?
So it's generally, it's generally. Many are trained clinicians, such as myself. I was a speech pathologist in a previous life, and I moved on to be an aged care assessor. Others have extensive experience in community services and aged care services. So they're highly trained, highly competent people who have worked in the sector for many years. And with KODA New South Wales, it's myself. I'm the team leader of the project, and I have a colleague, Caleb, as well, who's very good, very great. We're both quite new to the new trial, as the previous person had left. So we're learning as we go, and we're enjoying it, and we're getting having a really good experience at it.
Fantastic. I'm just having a look. I think that there was so much detail in your presentation, Terry. I'm not sure that we're going to get any more questions, but thank you so much. I do know from speaking to a lot of carers of older people that this is a very much needed service, and that individual tailored support is so critical to helping people at often a very difficult time.
Yeah. Can I just tell people out there watching, please, you're welcome to contact me and email me if you want to get your question answered, if you didn't have time to get it through or I didn't have time to answer it. So it's ACSN, so A for Apple, C for Charlie, S for Sam, N for Nelly, at COTA New South Wales, COTANSW.com.au.
And it might be that people don't want to disclose their personal circumstances and have very specific questions for you.
For sure, for sure.
Thank you so much for that opportunity, Terry. I'm sure it'll be much appreciated.
You're welcome.